We're still letting folks in, but I wanted to go ahead and welcome everyone to Friday Facts. So excited to talk with Hope Brooks in just a moment about Health Literacy Month and her work at Novant in patient experience. But I'm just going to say a quick hello and good morning and encourage you all to be sure to register for our Joining Our Voices third annual symposium. I'm letting folks in while we talk. We have a great lineup of events. October 30th, October 31st, and November 1st from 12 to 1:30. Just wonderful. I won't take too much time because I really want to go into our discussion with Hope, but please make sure to go to our website, make sure to register. And I think that's it. So I'm going to keep letting folks in, but I wanted to go ahead and turn it. Karen is going to take she's in the interview seat, interviewer seat today. I'm
Yeah.
just going to stop talking now. Karen, take over.
Okay. Thanks, Heather. And I hope you feel better
Thank
and
you.
enjoy the rest of your trip.
Thank you.
Hi, everyone. For those who don't know me, I'm Karen Appert. I'm the lead of the Caregiver and Patient Engagement Work Group of this Serious Illness Coalition. So I'm really excited to be able to interview Hope Brooks, in part because I don't know Hope. So it's always fun to get to know somebody and learn a little bit about them before you really even get to meet them. So I'm going to just give a quick introduction of Hope, and then we'll just get into a brief conversation. So Hope Brooks is a patient experience advisor with Novant Health in the greater Winston-Salem market, which I was excited to hear since I'm in Winston-Salem. So I'm hoping to meet her soon in person. Before coming to Novant Health, she worked at Atrium Health in Charlotte, where she focused on health literacy and patient experience. She has also worked at Blue Cross Blue Shield of South Carolina in the corporate training department. Her educational background is in public health and counseling. She has a passion for ensuring that patients can find, use, and understand health information and services, which I think we would all agree is so important, especially now. She believes that each of us working to care for patients at the bedside or behind the scenes can have a positive impact on the patients and caregivers they serve. So with that, I'm really excited to say welcome to Hope, and we'll get into our conversation. And as usual with Friday Facts, we're going to start with, tell us a little bit about where you grew up, where you're from, where you went to school, as much as you want to tell us about your background.
Mm. All right. Well, thank you all for having me. And I am excited because I really wasn't aware of your coalition before. So I think this is going to be a great connection for me as well. And so a little bit about me, I was actually born in Baton Rouge, Louisiana, but my family, mainly I grew up in Southern Virginia, Collinsville, Martinsville area. And then when I was a senior in high school, I moved to a town called Elkin, North Carolina, because my dad switched jobs. And I finished my senior year there. So I went to Appalachian State for my undergrad and then went right from there to the University of South Carolina, which is how I ended up in Columbia to get my master's degree in public health. And I wasn't quite sure what I wanted to do at that point. I knew that I loved the idea of helping people and working in healthcare, but I also knew that I was not someone who would be able to be a clinician. I really admire all of our healthcare workers who can, you know, do all of the clinical skills and deal with blood and needles and all of that. But I wanted to be able to support patients in some way, and I had no idea back then that this career even existed. And so I started out with the Department of Health and Environmental Control in South Carolina, working with a grant for, we did car seat education and bike helmets. And then I ended up, when our grant was not refunded, I went to Blue Cross Blue Shield of South Carolina because I had done a lot of training in that role. So that's where I learned a lot about health insurance and how confusing health insurance is. To this day, I still think that that is one of the most challenging aspects of healthcare for people to understand, no matter what type of policy they have. Usually it's very difficult to navigate that. But then after spending 10 years there, I went to at the time, it was called Carolina's Healthcare System in Charlotte. And so I began to work on the other side. And it was interesting because I was hired as a training and development, I think it was consultant, but I had no idea that we were going to be working with this whole field of patient experience. I had never even heard of that. And so I ended up learning about that, loved the work. We had some organizational changes. I worked with Connie Bonebreak at the time, who was our chief experience officer. But after the organizational restructure happened, I ended up focusing on health literacy. So that was something that really became a passion of mine. And then after relocating, and actually being interested in a position at Novant Health because of one of my leaders who had moved to Novant, I interviewed with a team and we really do have a great team at Novant Health. I love working with the group that I am a part of, and I started working there. I guess it's been about a year and 3 months ago. And so that's kind of how I ended up in this field that I'm in. And I also will say, at some point when I was at Blue Cross Blue Shield, I was working full time, but had always been interested in counseling. And so I did go in the evenings and get a degree in marriage and family counseling. And I ended up being able to apply that education to my role with coaching leaders and helping to drive behavior change. So it's bizarre how all of those things came together, because I would have never imagined that there would be a role that would actually incorporate all of the things that I wanted. So I was able to find a role in healthcare where I could focus on caring for patients, families, and caregivers. It's not clinical, so I don't have to do any of the parts that, I'm not good at. I think the education piece from my public health background comes into play, as well as the counseling piece with, again, coaching, supporting others, and behavior change. So somehow it all came together, and I really do feel lucky to have a role that encompasses all of these passions. And I always tell people that, I know that there aren't a lot of these roles out there, but I feel so lucky to have landed in something that I truly do love. So that was a long answer, but
No, that I mean, this is great because what I like is you encompassed a lot of the things I was going to ask anyway. So that was a great summary. And now we can get to some of the fun, the fun details of, okay, so I'd like to kind of tease out where the health literacy and the patient experience kind of came together. For I like you said, I think a lot of people on this in this group understand how those work, but I'd like to hear it from sort of a behind the curtains. How does tell us more about your health literacy, what that involved. And I know it's health literacy month. I don't know if you have any information about what that means, what we should be thinking about as
Mhm.
a coalition, or what our members should be thinking about. And then also then I'd love to hear you tie it into the patient experience side of things. And I'm looking at it from the caregiver side. If you can tell us how both of those things, when you are a person who's either a patient or a caregiver of a patient or a loved one of a patient, what does that mean to them? How do they engage with, how does health literacy help them? And then also, how does the patient experience side of things help them?
Those are great questions, because I don't know if it's a misconception, but one of the thoughts that I would see a lot when we were doing a lot of education for health literacy is a lot of people really focus on that word literacy. And so I think people go to thinking about reading level. Can someone read? How much information do they already have about healthcare? Do they have a healthcare background? And it's interesting because when we think about health literacy, I think sometimes our concept of what we're thinking it is very different. And so The definition for health literacy used to be a person's ability to find, use, and understand health information and services. And it's interesting because they recently revised the definition of that because we know that there's always an individual component. So each person is going to bring with them a skill set, whether or not they can read well, whether or not they can understand health information. There are some people who are they have a lot of education and a lot of knowledge, but it just may not be in health information. So you can have someone who is an attorney who may struggle with understanding the instructions that their doctor gave them for taking care of their condition. And so what we really have focused on, and the way they evolved the definition, is there's the individual skill set, but there's also organizational health literacy. And that has been so important to me in my work because it focuses on the organizations. So right now for me, that's Novant Health, our responsibility in making it easier for patients and caregivers to find, use, understand health information and services. And so I love that they expanded the definition because I think it gives us a different framework. So now instead of thinking, well, this person just doesn't understand a lot, we say, what are we doing? It's up to us to make things easier. Are we writing things in plain language? Are we using some of the skills that we know can help confirm understanding, such as teach back? That's basically making sure when we are giving someone information that we are having them tell us or explain in their own words what that means. So, a lot of people are uncomfortable with teach back, even though it's a really effective skill. And it can be as simple as, hey, I know we talked about how we're changing your blood pressure medication today. I know that can be really confusing. Could you tell me starting tomorrow how you're going to take your medication? So if the patient can tell you correctly, then we know that they've understood and we know that they're more likely to have a better outcome. And if they are not able to tell us, it gives us an opportunity to reteach or, go over the information again until they do understand. So, when it comes to health literacy, it's pretty broad. It can be anything from if a patient decides I need a doctor's appointment. If they go searching for that information, have we made it easy for them to find it? If they log onto our website, is it clearly marked on how to call the office or make an appointment online? When they have their appointment, is it easy to find the office? Wayfinding is a big piece of it. Or in the hospital, if you are trying to go to different departments, have we made it easy? Do we have any way to help them figure out where they're going? It can also be understanding if I have an appointment and someone says, you need to fast before your appointment. Well, what does that exactly mean? There's a lot of, misunderstanding when it comes to some of these things. Of course, a huge part is making sure that when our providers and clinical team are working with patients and caregivers, they're explaining using terms that patients understand. Do we give them educational resources that are helpful, or do we give them a 10-page summary that the information's buried in there, they're overwhelmed, they're not feeling well, they've got a lot of information to go through and it's super hard to find it. It can also be understanding their insurance and billing. When they get that bill, do they understand what it means? Is it clearly um, described, what services were covered by insurance, what they owe? So it's a really huge scope when we come to health literacy. And I think with patient experience, one of the components is, we talk about it's every interaction that the patient and caregiver are having with the healthcare system. Again, from the person who greets them when they walk in to, the person who may call to explain their test results. Do they understand? Do they feel respected? Do they feel that they are cared about as a person? And I think you can't have a good patient experience if you're not able to understand and use the information that we've given them.
I'm sorry, I was just typing because this is amazing, when you think about all the places that your job can touch. It's a little overwhelming, which so one of my big questions is, where does it start for you? And I guess now it would be on the patient experience side. Um, how how do you get involved in all those things that you just described? Is it someone within the system coming to you and saying, "We've heard that this is confusing. A lot of our patients are saying this is confusing. How can you help?" Or is it or do patients come directly to you? How does this something even get started with what you're doing?
Well, with the current framework that we have at Novant Health, we actually have the Office of Patient Experience. And so we have advisors that support all of our facilities and medical clinics, hospitals. So we have actually 4 advisors in the greater Winston-Salem market. And so, for example, I support Kernersville Medical Center. I support our outpatient surgery centers. There are 3 of them in our market. And then I support all of our adult primary care clinics and our surgical clinics. And so basically, we've kind of taken all of our facilities and divvied them up between the advisors. But I think the way it starts is, as a system, Novant Health has made a commitment to our patients. And we have a cause statement that we adhere to as far as trying to drive the work that we're doing. So we want to um, create a healthier future, and doing that through providing remarkable experiences for our patients. But we have metrics that are set around patient experience. We have goals, and we take them very seriously. And so a lot of times, the way that people let us know about a specific problem, it may be that they are actually, let me back up. I feel like that's not really where I wanted to go with this. So we have, I would call it a very proactive framework. So we have a program that is set up so that we are already providing a lot of education and resources to all of our leaders so that they can be successful. We also have a set of standard behaviors that are in place that set the foundation for the patient experience, and it includes health literacy. For example, um, there are many of these, but one is as basic as create a warm welcome for our patients and caregivers. We have using plain language. That is one of our standard behaviors that we have educated our whole group on so that they are aware that's what we're supposed to do to help patients understand, using Teach Back. So all of those things are already in place, and we do a lot of development with our leaders so that they can lead their teams and make sure that everyone understands what they need to do and that they're using these resources. A lot of times, in addition to this ongoing education that we have and resources and support, someone may say, "Hey, we're really struggling in this area. We need some support because we are getting feedback that our patients don't understand their discharge information." So sometimes we will go in because someone has asked us to come in and help. Sometimes we will get feedback, from our metrics saying, "Hey, we're not doing well in this area. We need to go out and figure out what's going on." A lot of times we'll do observations. We will work with the leaders to make sure that they have the resources they need. I don't know if that helps.
Yeah, that was exactly what I was looking for, is just to understand where the seed of something that you need to get involved in would come from. So that was very helpful. So we've got plenty of time. I wanted to do a couple things on just thinking about this organization, or this group here, this membership group of the Serious Illness Coalition. We're made up of a lot of different organizations that either are involved in healthcare or in which healthcare, it touches the members or the members, the patients and the caregivers that the members are working with. Um, any thoughts on what a group like ours could do? Is there any way we can help you to promote the kinds of things you're doing, or I guess, just thoughts about the connection? Because I think this connection is really good, and I'm really glad that we were introduced to you.
Well, and it's interesting too, I think, because on a personal level, and I hadn't mentioned this, I also have a connection because my mom has stage 4 lung cancer. And so as a caregiver, I have been pulled into a lot of the complexity of having to, not having to, wanting to support someone who has a serious illness. And I think when it comes to the work that you all are doing, I think what is so important and critical in a lot of situations. There's so much information, and I think it can be very overwhelming, at least in my experience, when you are dealing with something that is very serious and complex and nuanced. And I think that even, for us, when my mom got diagnosed almost 5 years ago, my sister, my stepdad, my mom, and I were all in the room, we're taking notes. And sometimes we would have a completely different understanding between, and we're like, we're pretty health savvy people here. We're pretty smart, and we are struggling. And so I think there are a couple of different things you can do. One is, I think, always encouraging and making people aware that this is a need for everybody. One of the things that I would run into when I was focusing specifically on health literacy is there was this perception of it's those people. Those people that don't have a high level of education, and those people that didn't graduate high school, or those people that can't read. And I would say, no, it's me who has a master's degree. I am struggling here. And so I think having that empathy and compassion for people who are going through that, making sure that we are understanding, the situation they're in, and not ever making patients feel like a burden if they have questions or if they need more information. I think there's advocacy on the personal side. I do some volunteering with a group for cancer patients, and I always tell them, don't be afraid to ask questions. Don't be afraid to say, hey, can you go over that again? I think also when it comes to some situations, when you think of advanced care planning, end of life planning, a lot of times you just don't know what you don't know. So I think it's up to organizations to really make sure we are providing information to patients that they need to make the best decision for themselves, and knowing that we can't rely on them to just ask questions because they may have never been in this situation before. So they may not know what to ask. And I think really thinking through, what would a person who is dealing with this need to make the best decision for their loved one, their family, themselves. I think that's really important. Having a culture of it's okay to ask questions, it's okay to ask me again. It's okay to ask me to explain it in a different way. Do you need me to draw a picture for you? Do you need me to send you a video that explains it? Would you rather me explain it in a conversation? Or are you the type of person that wants a handout that you can take home and read later? I think those are all really important. And it's just this mindset of everyone struggles with health literacy, because one of the things, and I could talk for an hour on this, but the largest study that was done assessing health literacy levels in the United States was the adult study on literacy, but they had a sub component on health literacy. And what they found is only 12% of American adults are what we would call proficient, fully capable in health literacy. And so that means most people are going to struggle with some aspect, whether it's understanding the medical terms, understanding how the insurance is going to pay. So I think just going in with that mindset of we know that you don't have all the information we do, and we are here to help you. Does that answer your question?
Absolutely. One of the things that I felt really connected to is when you gave the example of you can be an attorney, you can have a high level of education and still not understand what the doctor just told you. And there's that emotional component too, especially if you're the
Yes.
patient or caregiver. We don't hear very well when we're emotionally involved in a situation. And by the way, I'm sorry to hear about your mother, and I best wishes for her ongoing treatment. I'm going to just open it up to questions. I see Heather. Let's see, Heather. Do we think there's something challenging about the term health literacy then, as that people don't see themselves with that issue? Do you think that's just the term itself?
I do, and it's interesting because, one of the physicians that I worked with at Atrium Health when I was there, she was very involved in, a lot of the work nationally around health literacy, and she was telling us that they actually had tried to figure out if they could rename it because of that, and she said they really couldn't come up with a better term. They went round and round. But I sometimes think of it as, when you're talking to people, I think the literacy term really gets people, but just saying, we want to make sure that you understand everything about your health, about, the services and the processes, and we want to include you in that so that you can have what you need to make the best decision for yourself or your family. I think I wish I had a better word for it or term, but I do agree that it can be confusing.
And I just want to open it up to anyone else who might have a question. We have 3 minutes left, and I know sometimes it's hard to type a question into the chat if it's a long one.
Mhm. There,
Mary,
i-
oh,
oh,
sorry.
there is another question in the chat, Karen.
Oh, I see that.
Deborah
Yeah.
asked about what type of schooling or certificates do you need to work in this area?
I don't think there's necessarily one particular track that you have to follow. I do know that. So I started out in public health with health promotion and education. And one of the certifications that a lot of people in that field have is the Certified Health Education Specialist. And I have noticed that a lot of people who work in health literacy do have that certification. I don't have that one. I did find some specific education. We were actually able to go to Tufts School of Medicine. They have a health literacy leadership institute that I attended a few years ago that I found really helpful. But I think that it's something, health education. A lot of people who have a nursing background or another clinical background find their way working with it. But I don't think there's necessarily, one specific path or um, certification. Right now, there's not a national certification for a health literacy specialist or anything like that. But there definitely are organizations that you can get involved with, or resources, and I can provide some of those for everyone, that you could maybe include when the recording comes out.
That sounds great. And then Mary Bethel, I saw you came off mute. Did you have a question?
No, I was just gonna make sure you saw the other question in the
Oh,
chat.
thank you.
Thanks. So,
Um, oh, and I see that someone posted almost all hospitals now have an office of experience, and that office can be helpful for caregivers who are struggling with situations within any institution. And I guess as a caregiver, I have a question about how how does I think in all the times I ever was in a hospital, I don't know that I ever got offered to talk to someone from. I mean, people might come in and talk to someone, but a lot of times, as you know, in a hospital situation, especially, you may not be there when the person comes in to find you, and you may not have time to connect with that person. What's the best way for a caregiver to find out about those offices and then connect with them, maybe in an acute hospital situation?
I think this is where every hospital is probably set up and structured a little differently. So we have, in my in our organization, the advisors, we are more there to support the leaders. So I'm not necessarily on site talking with patients all the time, but we do have what we call in our organization patient partnership, and they are under our umbrella. So they are there if someone needs to talk about, something going on. We also have patient advocates. And so for Novant Health, if there is someone who wants to speak to one, they can request to speak to a patient advocate, and they would put them in touch at
Okay.
that point. But I know
Great.
every hospital has that set up a little bit differently. But that's where I say, being your own advocate, no matter what situation you're in, or if you're advising people, they can always ask for a patient advocate, or, they can use that term, and they should have some sort of similar role that they can offer to the patient and family.
Good to know. With that, I'm going to wrap it up. We're at time, and Hope, I really appreciate you coming and talking to us. I think this was very informational, and I think it's always good to hear, especially about some of the things you mentioned about just thinking about health literacy a little bit differently, and even the patient experience and involving that in it. So we really appreciate your time coming and speaking to our group.
Thank you. Could I add one more thing quick just to sum it up?
Absolutely.
So again, I think one of the things that works really well for us at Novant Health is the fact that executive leadership has established this as a priority, that we are going to deliver a remarkable experience. And so I think the fact that it comes from the top, and that we are constantly educating our teammates and providers, we are providing resources, providing support. That's why my position exists. I think one of the ways to ensure that an organization is going to be successful in this is if you have that top leadership support, they make it a priority, and it's part of the program. It's the other thing with patient experience is it is linked with quality and safety. So it's not just being nice to people. If someone doesn't understand what they're supposed to do to take care of themselves, they're not going to have a good outcome. And that is linked to quality and safety. So I think making those things a priority and a foundation of your organization, it has to start there. So I would just, make sure, that piece is emphasized.
Excellent way to end the recording, and we really appreciate you saying that, because I think you're right. I think that's very important, and it is nice to know, as we go into, uh, I mean, when we think about healthcare now and how much it's changed since COVID and all the things that are being done, um, in the with those changes, and some really good and some not so good. I think it's great to hear that there are organizations that are really thinking about that from the patient side of things. Um, and I think we're at time, so I'm going to wrap it up and just say thank you again, and we hope to have you engaged in our coalition going forward.